Welcome back to our channel. We are Pharmacist. So in today's video we're going to talk about drug of choices in pregnancy. So let's start. So our first is drug of choice in ectopic pregnancy, that is methotrexate. Next is drug of choice in induction of labor, that is oxytocin. Drug of choice in postpartum hemorrhage, that is oxytocin. Next is drug of choice in hypertension in pregnancy, that is alpha methyl-dopa. Another is drug of choice in endometriosis, that is danazole. Next is drug of choice in asthma, that is beta 2 agonist. Drug of choice in postpartum engorgement, that is oxytocin. Next is drug of choice in seizures in eclampsia, that is magnesium sulfate. Another is drug of choice in seizures during pregnancy. Drug is phenobarbital. Next is drug of choice in hypertensive emergency in pregnancy, that is labetalol. And last is drug of choice in postpartum hemorrhage, that is oxytocin. Next is drug of choice in falciparum malaria in pregnancy, that is quinine. And drug of choice in the cerebral malaria, that is again quinine. And drug of choice in gonorrhea, it is penicillin or ceftriaxone. Another is drug of choice in toxoplasmon in pregnancy, that is spiramycin. Another is drug of choice in malaria in pregnancy, that is chloroquine. Drug of choice for acne, it is erythromycin and benzyl benzoate. Another is drug of choice in epilepsy in pregnancy, that is phenobarbital, that we have already discussed. Drug of choice in mania in pregnancy, that is olanzapine. Drug of choice in hyperthyroidism, it is propylthiouracil. And drug of choice in hypothyroidism, that is levothyroxine. Another is drug of choice in bacterial vaginosis in first trimester, that is clindamycin. Drug of choice in cholera in pregnancy, that is furazolidione. Drug of choice for typhoid fever in pregnancy, that is cefuroxime and ampicillin. Next is drug of choice in ambeosis, that is metronidazole, which is contraindicated in first trimester. Last is drug of choice for in ambeosis in first trimester, that is furazolidione. Now let's move on to the next slide. So another is drug of choice for preventing the neural tube defect, that is folic acid. Drug of choice for anticoagulation in pregnancy, that is heparin. Another is drug of choice for mania, that is lithium. And last, another one is drug of choice for myasthenia gravis, that is neostigmine. And another is drug of choice for thrombophlebitis, that is aspirin. Another is drug of choice for urinary tract infection during pregnancy, that is ampicillin. Another is drug of choice for HIV in pregnancy, that is zidovudine and nevirapine. Another is drug of choice for resistant typhoid, that is ceftriaxone. Another is drug of choice for TB, that is isoniazid and rifampicin. Another is drug of choice for B12 deficiency, that is cyanocobalamin. Another is drug of choice for iron deficiency, that is ferrous sulfate. Another is drug of choice for antiplatelet action, that is aspirin. And last is drug of choice for anxiety, that is benzodiazepine. So moving on to the last slide. So drug of choice for pain, it is aspirin or PCM. And next is drug of choice for depression in pregnancy, it is tricyclic antidepressants. Another is drug of choice for superficial thrombophlebitis, that is again aspirin. And drug of choice for bacterial vaginosis in first trimester in pregnancy, that is clindamycin, that we've already discussed. Drug of choice in rosacea, that is NSAIDs. Drug of choice in seizures, we give benzodiazepines. Drug of choice in seizure maintenance, we give phenobarbital. And drug of choice for arthritis, we give aspirin. Another is drug of choice for schizophrenia, we give phenothiazines, like example haloperidol. Drug of choice for seborrheic dermatitis, we give salicylic acid. Next is drug of choice for psoriasis, we give topical corticosteroids and salicylic acids. And last is drug of choice for Shigella dysentery, that we give ampicillin. So that's it for the today's video. So all these drugs are safer in pregnancy. You can make notes of these drugs in your notebook and try to remember them. All the best for your upcoming exams. Thank you so much. Please like, share and subscribe.